everyone, and welcome to the Doctor of the Future. I'm Dr. Krystosik, aka Dr. J, and you're listening to the podcast that teaches you, your family, and your loved ones how to unleash that healing power inside your body. We're doing it without drugs and surgery here on this program, and our call to action here on this program is based on the quote from Thomas Edison. The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and the cause and prevention of disease. That's what we stand on. And we firmly believe that natural medicine is the way to go. It's the first choice in non-emergency illness. And we're here to help to show you how to end suffering, because suffering ends when knowledge begins. And the good news is your body has the ability to heal itself. And when you take action, health appears. Health appears, folks. That's exactly right. And that's what we're all about. So we want to get started right into the program. Remember, each week here, we are bringing you interviews with doctors who are thought leaders. Not only doctors, but just people, visionaries who are leading the way in drug-free medicine. And so we want to teach you how to be able to use foods and herbs and lifestyle and exercise and stress management. We want to change the face of medicine. And we're bringing you the movers and shakers who are revolutionizing this whole health structure that we have in this country so that we can treat disease by getting to the cause. And so we're bringing these thought leaders, their research, their discoveries, their clinical findings, so that you and your loved ones can be able to live without fear. And that's exactly what needs to happen today, because so many of us are just facing fear right now because of COVID-19 and all the fear that surrounds that. And so we just want you to know that we're going to provide you with tools here on this program to be able to help you to live without fear. You know, right now our whole country is holding its breath in anticipation for what's going to come next, especially with the flu season coming up real soon. It's easy to become fearful. Well, especially when you're considering the barrage of bad news that we get every single day on TV and the news media. It's just overwhelming. See, the current pandemic has created uncertainty over many things. Well, the economy and finances, and most importantly, our physical and mental health. And with all this going on, we're all looking for some kind of security, aren't we? We want to feel safe, and we want to have some certain sense of control. Control over our lives and our well-being. But the reality is that the fear of uncertainty, this fear of uncertainty can leave you stressed and anxious. It can drain us. It drains all of us emotionally, and it can trap you in a downward spiral, and endless what ifs. What about this and what if that? In the worst case scenario, we think about what's the worst thing that tomorrow can bring. But here's the good news. There are many steps that we all can take to deal with COVID-19. This crisis can be dealt with, and we can take the steps to alleviate the fear and anxiety and allow us to face the unknown with some confidence. And today, Dr. Galland is going to show us and teach us how to be able to use nutrition to do just that, to protect you and your loved ones so that you don't have to live in fear and anxiety. But before we start to listen to Dr. Galland, what he has to share with us, I want to share a few things with you. Well, the first thing I want you to realize, and the first thing we need to realize, all of us need to realize, is that the COVID-19 is a virus. And we've been threatened by viruses since the beginning of time. Our bodies are equipped, though, to deal with viruses. It has an immune system, and our immune system has the resources to be able to overcome viruses. So that's the first thing we need to realize. And there's a lot of things you can do to help your immune system to be able to, first of all, prevent the COVID, and then once you get it, to be able to recruit all the resources inside your body to be able to fight it. Listen, we all still got to get out of bed in the morning. We got to live with the reality of this invisible intruder. Nothing really changed. Things are the same. It's a lot more fear that people are living with now, and that's created a lot by the media, but we have the tools, important tools. And the first tool is our mindset. We have to keep positive. We have to laugh more. Scientists tell us that laughing helps to boost our immune system. So please find ways to laugh. Laugh with your friends. Tell jokes. And remember this. Staying healthy is our best defense against this COVID-19 or any illness. And of course, you should follow the guidelines that are currently being recommended. No doubt. Social distancing, wearing masks, washing your hands. Yeah, these things could be definitely contributing to the benefit of helping protect against the COVID-19. And yes, they are controversial. And whether or not they help is not the question at this point. The reality is they can't hurt you, and they may even help. And while a mask may not be the perfect answer, it's not going to do you any harm. So why not? It may help us. So follow the recommendations. But we need to go beyond masks and social distancing and of course, washing our hands. And today, Dr. Galland is going to be talking about some of the things we can do. And he's going to be talking about two important lifestyle factors, food and exercise, and how they play a big part in protecting us from the ravages of COVID-19. And so food is the best medicine. Don't forget that. And unfortunately, the standard American diet, abbreviated SAD, it's a prescription for disaster when it comes to dealing with COVID-19. And Dr. Galland is going to be talking about how sugar, especially sugar and high fructose corn sugar, it's almost in all processed food, it's the number one culprit that can fuel COVID-19. And how fructose sugar and all sugar in general leads to what we call metabolic syndrome in the medical community. It's a condition that affects over 35% of our population. And what is metabolic syndrome? Well, it's a combination of high blood pressure and obesity or being overweight and having problem with metabolizing sugar, insulin resistance, and of course high cholesterol, and as I mentioned, high blood pressure. So this metabolic syndrome is definitely something that we need to address. And a study just recently published in the Diabetes Care Journal showed that people who have metabolic syndrome are 3 times more likely to die from COVID-19. And they also showed in this article that the underlying problem with the metabolic syndrome is inflammation. Runaway inflammation is the number one cause of death from COVID-19, and metabolic syndrome, the leading problem that causes and happens with metabolic syndrome, is inflammation. So we've got to deal with this, and Dr. Galland is going to give us tools on how to help to be able to deal with this, and eating a healthy anti-inflammatory diet is the number one step. So he'll also be talking about how we can effectively lower our risk factor for COVID-19 by helping to raise up higher levels of what's called ACE2 enzyme in the body. Now, ACE2 is a good thing. It's an enzyme our body produces, and it helps to protect us against COVID-19. It's essential, ACE2, and we need to preserve it, to protect it, because ACE2 helps to, protect our lungs and our heart and our blood vessels and our kidneys and our liver and our gastrointestinal tract, our intestines and our stomach. And so it's important that we help to protect ACE2. And there are things we can do, and Dr. Galland will talk about things we can do to increase ACE2 levels, because ACE2 is vital to our health. It's critical for helping to regulate blood pressure and to help to, normalize blood pressure and help to in wound healing and help to decrease inflammation. Remember, inflammation is the number one cause of the runaway death that happens with COVID-19. If you have inflammation, runaway inflammation is going to cause death in COVID-19 illness. ACE2 helps to prevent inflammation. So that's a key factor. And we can talk about those things today, about how to increase ACE2 level and protect it. So COVID-19 is a factor that we don't need to fear if we know what to do to help to prevent it. And again, ACE2 is present in all people, but in different quantities in different people. And as we age, we lose some ACE2 in our bodies. So we got to help to try to build it up with proper nutrition and decreasing sugar levels and preventing metabolic syndrome so that the coronavirus doesn't advance inside of our bodies. So that's important. And then if the ACE2 is depleted and metabolic syndrome starts to overtake inside of our bodies and we end up all this problem with sugar metabolism, then the virus could begin to spread in our bodies, and then the virus will release another enzyme called 3CL protease. And once that COVID-19 releases 3CL protease in the body, it could then duplicate itself, replicate itself, and it could spread through different cells in the body and then cause ravages throughout our entire body, cause the lungs to shut down and to cause heart disease and to damage the blood vessels, which causes death from the COVID-19. So get ready to listen carefully to Dr. Galland today, and he'll be talking about how we can build up ACE2 and how we can block the 3CL protease and block furin, another enzyme. And he'll be talking about these things and what we can do proactively, which is exciting. So get ready for a great presentation by Dr. Galland today again. And we're going to try to provide you an easy way to understand some of these technical terms that Dr. Galland says in his presentation. But the most important thing I want you to realize is that if you take steps, if you take these actions, if you take a proactive role in doing some of the things that Dr. Galland's saying, and be able to take charge of your health, you're going to be able to overcome the fear of living with the dangers of COVID-19, and you're going to have confidence. I encourage you, share these things with your family and friends and loved ones, because these are critical factors to help you and your loved ones to be able to live without fear, so that we can put a mask on COVID-19. We could put COVID-19 in quarantine instead of putting and keeping us in quarantine. So right now, let's start to listen to Dr. Galland and what he has to share with us.
So tea is a very interesting substance. I mean, it's loaded with these catechins and flavonoids.
But I'm a big proponent of oolong tea. Why is that better?
Well, so here's the thing. Tea starts with green leaves. Okay, so the green tea is rich in EGCG, which is a catechin that has anti-cancer and anti-inflammatory effects. When you ferment the leaves partially, you get oolong tea. And that partial fermentation produces a group of substances called theosinensins. They have profound anti-allergic effects, which is why I like oolong tea for allergy.
I didn't realize it was fermented. That's really
it's a very brief and incomplete fermentation process.
Is there any probiotics? Is there any probiotics in that?
Well, I'm sure there are, but they would be the organisms that are naturally living on the leaf on the tea leaf.
Gotcha.
Then, if you allow that fermentation to go on further, you get black tea, and black tea is rich in substances called theaflavins, And some of those, the theaflavin galates, are 3-CL protease inhibitors. Now, if you take your black tea with milk, you're not going to absorb the theaflavins. So you need to take it straight, and you probably should brew it strong, and it should probably be fairly astringent. But black tea, quercetin, natural source of quercetin is probably onion skins, but there are many foods that have it and many herbs. Those are 3-CL protease inhibitors, and with things that are safe like the black tea or the quercetin, it's probably worthwhile those are probably worthwhile starting in advance. So you build up these flavonoids in your cells.
Some of these flavonoids are not really very good absorbed. They don't have good absorption in our bodies, so you want to build them up slowly, right?
Right. They're not absorbed very well, and they also are metabolized and bound by tissues. And as is what's been shown for many of them, and actually this has been shown for resveratrol, is that the duration of exposure is probably more important than the degree of exposure, because it just builds up very slowly. The other substance that inhibits, or food that inhibits 3-CL protease effectively, are elderberries, elderberry fruit. And because elderberries have been shown to be helpful in treating the flu, because the anthocyanins in elderberries also work very much like Tamiflu. They inhibit the same enzyme that Tamiflu inhibits, and so elderberry can work quite well for the flu. Because of that, there was a run on elderberries back in February, and they pretty much got almost impossible to find them. I think elderberries...
They grow wild here in Ohio. Do they grow in New York as well? Elderberry flowers, do they grow there?
Yeah, but you have to stick with the fruit, because the other components of elderberry may be toxic, unless you heat them. Heating destroys the toxins.
This fall, I'm going to go out and start foraging for lots of elderberry and be able to sell it next year.
Yeah, right.
They're just wild everywhere.
Organic elderberries, I think, are a good preventive. What the data showed is that exposure to cells to elderberry in advance of the infection works better at preventing viral growth and spread than waiting until infection occurs. So I have recommended elderberry extracts in advance if people are in a high-risk situation. But I think you have to be very careful with elderberry, because in addition to the anthocyanins, which are inhibiting the protease, elderberry also has polysaccharides, complex sugars, that are very immune stimulating. And when you get sick with this infection, you don't want to overstimulate your immune system.
Well, before we get into phase 2, Dr. Galland, I was just curious to know, and if the protocol you were just describing is so effective in helping people in phase 1, could we assume that it'd be great to use those things prophylactically so we don't get the flu? Don't get the COVID-19?
That's what I've been recommending with my patients, is that they start this protocol in advance. And what I described basically are things to do. There's a sort of a stage 0 where you're in quarantine, you're not highly exposed. Let's just work on building up the flavonoids that you need and strengthening the resilience of ACE2. Then you get into an exposure situation. Then let's bring in some of the big guns or bigger guns that inactivate furin or 3-CL protease, with the idea of keeping you from ever moving on to getting sick. Now, of course, it's very hard. So many people breeze through this without getting sick naturally that it's hard to document the effectiveness of this. But the patients that I have want to know, what can I do? I don't want to just sit home and wash my hands and face and wait for the leaders to tell me what to do. I want to know what I can do myself.
You know, I'm kind of curious, Dr. Gillen. We know that the virus is spread through the air, and the virus can be, if somebody coughs or sneezes, they can spread at 27 feet. How is 6 feet going to prevent us from
Well,
getting?
6 feet is a number that was pulled out of a hat, really. I mean, we don't know whether 6 feet is enough. There seems to be, that's why masks are being recommended, mostly because there seems to be a general experience that when everybody uses masks, there's less viral spread. And in the countries where they're kind of habitually used, there's been less viral spread. So,
Okay, so once somebody gets into, let's say, the phase 2, when they, you know, are getting much sicker, what do you recommend at that point? Because I know there's some cautions that you have that they shouldn't try to do. Because I know a lot of people that are in the natural circles that could be listening to the Doctor of the Future podcast. They think, oh, well, you're really sick with the virus. Go ahead and boost the immune system. That according to you, is not a good idea. Or might not be a good idea.
I think there's a general consensus that's emerged in the conventional as well as the integrative medical community that just general immune boosting strategies don't work well and for this virus, and may actually wind up doing more harm than good, especially when someone's sick, because the clinical course of this illness involves excessive inflammation. And this is where ACE2 is really important. And understanding...
That's the cytokine storm, right?
Yeah, the cytokine storm that occurs is to a large extent the result of ACE2 deficiency. And I think all of COVID-19 can be understood once the illness really sets in as being the result of a defective action of ACE2. The effect of ACE2 in the body normally is to improve circulation, prevent unnecessary scarring, be anti-inflammatory, inhibit blood clots. ACE2 produces as its end product a peptide called angiotensin 1,7 or ANG1,7. And if you administer ANG1,7 to an animal or a human or in a test tube, these are all the effects of ANG1,7. Now, the ways in which people are dying from COVID-19 they're not dying from pneumonia. They're dying from heart failure, circulatory collapse, blood clots, kidney failure, all things that occur as a result of ACE2 deficiency. So when someone is getting sick, if just inhibiting 3CL protease and furin with natural products is not enough, I think the next stage becomes finding ways to overcome the impact on ACE2. And there is a herb widely used in Chinese medicine, Scutellaria biacalensis, has an ingredient called biacalin that has been shown to have similar effects to ACE2 in the body. See, angiotensin 1,7, and I'm sorry if I'm getting very technical here, but it's the only way to really work through this. Angiotensin 1,7, which is produced by ACE2, has its effects because it stimulates a receptor called the MAS receptor. And so if ACE2 is impaired, and it would be nice to be able to administer angiotensin 1,7. I've been working on trying to find sources of that. Very difficult. But biacalin circumvents that and goes directly to the MAS receptor to stimulate it. So what I hope to see are further nutritional and natural therapeutic approaches to overcoming the ACE2 deficit that leads to the catastrophic illness.
Okay, I'm glad you listened today to the program, and I hope that you really got a lot out of what Dr. Galland had to say. And until next week, where we share the last portion of Dr. Galland's presentation. I'm Dr. Krystosik, aka Dr. J, and here's to your health.